her and her cousin, her and her sister, they gotta go. Okay, it's time for them to leave. Let's talk about my keloids, part 4. So I know I said the last video was going to be the end of the series, but I decided to just continue on with the series since I'm going to be keeping you guys updated with my journey and my process anyway. Just wanted to come on here and give an update about my test results, the surgery upcoming. First things first, blood test results. Primarily, I did blood work with my primary care doctor, and she said on her lab work that it seemed I had high cortisol and high testosterone. So she referred me to an endocrinologist who then did some further examination. When I went to the endocrinologist, he further explained the testosterone levels and did some more testing for my cortisol levels as well. So for the testosterone, he said that there were like 2 different kinds of testosterone. There was like the testosterone that attaches to proteins in our body, which are non-active testosterone. And then he said there's the free testosterone as well. And he said my free testosterone level was normal. It was the other testosterone that appeared to be high, but he said those are non-active testosterone. In his interpretation, from what I took it as, I don't have, high testosterone levels and I'm within the normal range of testosterone. The second part was the cortisol. So he did a follow-up test with that where I had to take a pill and then at like 11 o'clock at night and then do a fast until the next morning where they did some initial blood work again. And that result came back as my cortisol levels being normal. All in all, he said my cortisol levels were normal, my testosterone levels were normal, so I didn't have any issues in that area. I did ask him about the PCOS as well. The determining factor, or the 2 main determining factors, I guess, is irregular periods, difficulty conceiving, or having children. So he asked me, 1, if I had been pregnant or had any pregnancies, and also he asked me about my irregular periods. So he said pretty much he doesn't think I have PCOS because those 2 factors were a non-factor. I didn't do any testing for that. I don't know if there's an official testing for that or if there's just different factors or symptoms that contribute to that. I do have the hair growth still on my face, like my jawline and stuff. The hormonal acne, I don't really suffer with anymore. I just have the keloids that I'm dealing with. Maybe I don't have PCOS. I don't know. That's what I took from it. So I'm just going to roll with what the professionals are saying. I've asked multiple doctors and I went to a specialist who also has told me now that I do not have PCOS. I don't have high cortisol and I don't have high testosterone. So as far as my hair growth, I did ask him about that and different things. He said weight loss can also help to relieve some of my symptoms and things of that nature. So I am working on that, but that's going to take a little minute. That is the update on the test results. I know you guys recently saw a video where I was talking about finding a surgeon or doctor that can get rid of and remove my keloids for me once and for all. I didn't want to do a video about it until everything was kind of like finalized more so, and I had a date. The name of the doctor that I found is called Dr. Keloid. He has a 95% non-return rate for the keloids. And the process that they do is they excise the keloids and then they do like a superficial radiation therapy, like a little bit beneath the skin to get rid of the keloid cells so they don't grow back, which I thought was pretty thorough. So that's the process and kind of how that works. I am scheduled to do my procedure in July, which insurance does cover. Well, my insurance did cover most of the procedure, so that works. Super excited to finally be getting some resolution to this. Yeah, I'm just ready. I'm ready for these to be evicted, okay? Her and her cousin, her and her sister, they gotta go, okay? It's time for them to leave. I'll definitely keep you guys posted as I continue to get more updates and things like that. But yeah, that is this video. So stay tuned for the next one. Bye.